Hello everyone, thank you for joining us. My name is Christina Valentine and I am entering my third year in the occupational therapy program at Chicago State. My partner Jessica and I would like to discuss the case study of Nia G. So first, let's get to know Nia. She is 5 years and 11 months old. She has multiple disabilities as her primary diagnosis. She has neurofibromatosis type 1 specifically. She also has a history of hypoxic ischemic encephalopathy at birth and a developmental delay, scoliosis, and sickle cell trait. She also has a visual impairment, which is her secondary diagnosis. This past year, she attended Chicago School for Afternoon Kindergarten. She was in a special education classroom with 7 other students. It also included a teacher, teacher assistant, and a classroom nurse. She has received integrated services throughout her school day, including occupational therapy, physical therapy, speech therapy, and other social services. She recently had her 3-year reevaluation to look at her individualized education program, and since she will be going into first grade next year. Nia has a lot of strengths. Some of them include some personal characteristics. She loves school. She really enjoys interacting with her classroom educators. She's always excited to learn new things and explore her environment. She's very cooperative in class and during therapy. And she also works very hard and perseveres during long, tiring tasks. Nia is able to independently feed herself, and as she's also able to drink from a straw or a cup, and she doesn't have any swallowing problems at this time, so eating is not an issue. Another strength of hers would be her fine motor skills. She is able to demonstrate a gross grasp on a crayon and imitate a vertical line, a circular shape, and also do some scribbling. She also has a raking grasp in which she's able to pick up small objects and she can transfer them from her left to her right hand. Nia has good sustained attention for up to 10 minutes during difficult tasks. She is able to follow one-step instructions, such as pointing to different objects that were named or described. She also likes to initiate play with her peers, including her sister and her cousin that is also 5 years old. And she demonstrates appropriate play, which is awesome. Another strength is her expressive communication. She has the ability to demonstrate different gestures, such as clapping and pointing. She can vocalize, such as laughing, to show like how she's feeling. She has one-word imitation. She can babble 2 syllables. She can also use direct selection for her augmentative and alternative communication device, which is new to her, but she's able to use it to express how she feels, if she wants to eat, and what she wants to play with. Her receptive communication is another strength because she can identify body parts, clothing, verbs, functions of objects, and inferences, such as, what's happening in a story, analogies, negation, and colors, and she can also point to an object out of 4 different choices. Gross motor-wise, she's able to pull herself up to stand at a supported surface. She can ambulate up to 100 feet with her rolling walker, and she can transfer to and from her wheelchair with stand contact guard assistance. She's able to propel her wheelchair 3 to 5 feet. Her visual skills are good in terms of tracking, figure ground, shift gaze, and visual motor skills of reaching across midline to pick up an object. Cognitively, her skills are pretty good compared to other domains, such as her adaptive skills. Some of Nia's weaknesses include mobility. She cannot walk independently. She requires assistance with transferring surfaces, such as getting on and off the toilet. She propels her wheelchair 3 to 5 feet, but it does expend quite a bit of energy, so it's not very efficient for her. She does require complete assistance with a lot of her personal care, such as toileting or other ADLs. For her fine motor tasks, she is below the skill level of her peer, such as like when she's turning pages in a book, or any type of tasks that require like fine motor dexterity or eye-hand coordination. Expressively, she's mainly nonverbal, and it can be difficult for her to ask questions or communicate her wants and needs, which is something that her parents really would like for her to be able to start to do for next year. For her receptive communication, she doesn't understand some pronouns, spatial concepts, or anything beyond like noun elaboration. So, additional sentence structure she wouldn't understand beyond like the subject and verb. And as far as oral motor skills go, she has decreased saliva control and speech production. She has lower vocabulary skills than compared to her peers, and she's easily distracted by things in her environment and often needs to be redirected back to the task. Some of her other weaknesses include abnormal muscle tone and motor control. She's got lower tone throughout her trunk, but then her lower extremities have increased extensor tone and her upper extremities have increased flexor tone, especially on her left side. She still has residual ATNR and STNR reflexes and decreased protective reflexes, which could present as a safety concern. Her posture isn't very good. If she's sitting with her legs out, she needs her arms to be able to hold herself up. But she uses W sitting, which is bad for her trunk, her core muscles, but she uses that instead of using her hands sometimes. And also during circle time, she often adducts and internally rotates her hips and kind of stacks her neck backwards, so it's extended, which can be difficult for her to have like good stability. And she also has decreased adaptive skills, and that's mainly due to her physical challenges. And also she has difficulty with her shoulders. There's not a lot of stability because her shoulders are protracted and elevated. So she uses her left hand as a stabilizer and her right hand to complete manipulation of objects. For vision, she has decreased convergence at 12 inches and divergence at 24, decreased depth perception, and poor visual acuity. And she also has a lazy eye condition and poor distance acuity, and she really needs objects to be close up in front of her. And with her depth perception, she often overreaches. Other problems she has is she gets easily fatigued visually, and she also experiences pain and soreness because she's had a lot of recent medical procedures done. So some of the assessments that were administered, just to give a quick overview, one of them was the Vinland 2 survey, and that just looked at her ability to adapt in her environment during her daily living activities. So it looked at communication, daily living skills, socialization, motor skills, and adaptive behavior. And all of her scores were below the average scores. And then the second assessment were different visual assessments. So previously she had an ocular report done by her optometrist, and he diagnosed her with the lazy eye and also poor distance acuity and abnormal ocular motor control. So at school they did a functional vision assessment, which kind of just gave an overview of all of her different eye movements, eye control, visual perceptual skills to kind of determine how this impacted her learning at school. So she showed that she had uneven pupillary response. Her tracking was pretty consistent, that's why she was able to cross midline and grasp an object. She did have the problem with convergence and divergence, poor depth perception, and binocularity, and her figure ground and shift gaze were good. And her visual motor, she would tend to overreach when grasping objects. The early childhood vocabulary benchmark test was just to show Nia's vocab in comparison to her peers. Was she able to identify pictures from, touching them, pointing to them? And she did score at the 62 percentile, so she had a lower vocabulary performance in comparison to her peers. And then the Hawaii Early Learning Profile just assessed her different sensory skills that were important for her adapting to her environment, so different play skills. Can she localize sounds? Can she recognize gestural cues? And this was an observational test. She fell between 30 to 36 months on average, which classified her as developmentally delayed. Another assessment was the developmental profile. It was completed by her previous teacher and her current teacher and the parents. It looked at her cognitive and adaptive skills because those were the two areas that were relevant. And for both areas, her cognitive skill and her adaptive, they were below the norm of her peers. For cognition, she was functioning at about 2.5 years, and for adaptive skills, she was functioning around 1 year and 4 months. For the pictorial test of intelligence, it included 3 different subsets: verbal abstractions, form discrimination, and quantitative concepts, and she received a score of 48% at both, which is considered a low percentage. So we developed a remedial plan with different strategies to implement for Nia. We said that Nia would benefit from one-step instructions, so this would allow her to be successful with completing each step, and that would really increase her self-esteem, throughout her school day. We also said that allowing her to use her iPad device or a computer to complete assignments would be very beneficial, because Nia has delayed fine motor skills, so maybe she wouldn't be able to do all of the different writing tasks that everyone is able to do. So instead, she could use this device to really